Thank you.
Yeah, thank you.
Okay, thank you. Good morning, everyone. I'm Jane Brennan, and on behalf of the League of Women Voters of Central Delaware County, I'd like to thank you for joining us for our annual holiday gathering, which this year, like everything else, is virtual. The mission of the League of Women Voters, a nonpartisan political organization, is to encourage informed and active participation in citizenship, elections, and democracy. To that end, we have offered several virtual programs this year. These have included Election Law, Process, and Security, presented by League members Jodine Mayberry and Jamie Mogul, Sorting News from Noise, featuring Aaron Shirachman, the Executive Director of PolitiFact of the Poynter Institute, and co-sponsored with the NAACP Media Branch, the 2020 election, The Politics of a Divided America, presented by Dr. G. Terry Madonna, nationally recognized political pollster and commentator, and director for the Center for Politics and Public Affairs at Franklin and Marshall College. And after a tumultuous experience following the election on November 3rd, two of our League members, Jack Nagel and Jamie Mogul, presented a stimulating and informative discussion titled The Election, the Aftermath, What Comes Next? And of course, that is still unfolding. Jack is a University of Pennsylvania professor emeritus of political science, and Jamie Mogul is an election rights lawyer. Our Civics Education Committee presented a program entitled Juvenile Justice in the Era of a Pandemic and Black Lives Matter, which was also co-sponsored by the media branch of the NAACP. This outstanding panel discussion was moderated by Jessica Fierman, who is the Senior Managing Director of the Juvenile Law Center. And the panelists included Kevin Bethel of the Law Enforcement Juvenile Justice Institute, Malik Pickett Esquire of the Juvenile Law Center, and Marcus Jarvis, an alumnus of the Juvenile Law Center's Youth Advocacy Program. In addition, we had 4 virtual candidate forums, which were coordinated with other leagues, including the League of Women Voters of Radnor Township, Lower Merion, and Narberth, and also the Chester County League. In addition, 2 of our members, Olivia Thorne and Ann Mazakowski, worked very closely with Delaware County Council and the Board of Elections to prepare for the November 3rd election, which incorporated so many new things, including mail-in ballots, new equipment, and paper ballots at the polls. All of these efforts were in keeping with our mission of making democracy work. And now for this presentation, we have received many wonderful questions in advance, and they have been shared with our speaker. Any additional questions that come in through the chat room will be shared during the presentation. And now to introduce our speaker, Dr. Monica Taylor, who is the Vice Chair of Delaware County Council. Dr. Taylor is also the County Council Liaison to the following county departments: Intercommunity Health, County Office for the Services to the Aging, the Medical Examiners Department, Housing and Community Development, Veterans Affairs, and Human Services. Dr. Taylor is leading the County Council efforts to establish a health department in Delaware County. For many years, the League of Women Voters of Central Delaware County has advocated for a county health department, and the current pandemic has highlighted the critical nature of this goal. Dr. Taylor will update us on the status of development of the health department. Dr. Taylor is particularly well qualified for these assignments, as she is an assistant professor of kinesiology and program director of the kinesiology department at the University of the Sciences in Philadelphia. She has earned a PhD in exercise physiology from the University of Pittsburgh. And on a personal level, Dr. Taylor has been involved in basketball since she was 5 years old and has played professional basketball in Ireland. I thought that was really neat. And so without further ado, may I present to you Dr. Monica Taylor.
Hello, everyone. Thank you to the League of Women Voters and others who are joining us virtually. Your partnership with the county is greatly valued, and many of you helped in our education efforts around both the primary and general elections, and many of you volunteered before and during the elections and after the election. Thank you. Your dedication and work helped us to ensure that all residents had a safe and fair election. Thank you for the opportunity to provide an update on the creation of the county's health department and the election. I will actually begin with the update on the election. As you know, the 2020 general election was in many ways unprecedented, both nationally and right here in Delaware County. The slate of changes brought about by Act 77 were significant, not only with modernizing our electoral system, expanding access to voting, and providing long sought safeguards to the integrity of our ballots through audible paper ballots, but also by challenging all election stakeholders, poll workers, election officials, Bureau of Election staff, our 3 Board of Election board members, county council, the media, and of course, organizations such as the League of Women Voters that have always taken on the challenge and responsibility of educating and engaging our voters to learn and adapt to a host of new processes and norms, all during a raging pandemic. I'm proud to say that we came together, we met the challenge, we kept each other safe, and we created a system in which anyone who wanted to vote could do so with ease. We saw record voter registrations, record vote by mail ballots, and record ballots cast. Despite litigation made against political parties, election boards, election workers, third-party organizations, members of county council, and the voters themselves, Delaware County held an election of historic scale, a clean election, a sound election, a scrutinized and transparent election. The county successfully defended more than a half dozen federal and state lawsuits involving everything from the legality of drop boxes and satellite voting centers to recounts, election contests, and unfounded daily charges of fraud and malfeasance. And ultimately, it was a bipartisan effort that resulted in this historic election success. Going back to 2019, Act 77, bipartisan, the Board of Elections, bipartisan, the Bureau of Elections and its committed staffers, bipartisan, the municipal officials that worked diligently with the county to install ballot drop boxes and secure in-person polling locations suitable for social distancing and other COVID considerations, bipartisan, and of course, organizations and voters themselves, all bipartisan. So for a quick status update, as most of you know, Delaware County certified our electoral votes for the 2020 general election on November 23rd. In all, the county met all certification deadlines, which frankly was very impressive considering litigation and 2 court orders temporarily enjoining certification. Efforts were made to block or challenge the certification of votes in multiple counties, but those efforts failed in the courts, and Pennsylvania's results were certified in accordance with the deadline. Basically, that means the election is over. For the presidential and vice presidential race, electors are scheduled to meet on December 14th to cast their ballots, and electoral votes are officially counted by Congress on January 6th. 2020 general election numbers for Delaware County set lots of records. We had a record number of registered voters at 425,000. We had a record number of vote by mail ballot requests at 155,000, a record number of vote by mail ballots cast at 130,000, record number of provisional ballots cast at 9,000, a record number of provisional ballots fully or partially counted at nearly 7,000, and a record number of total ballots cast at almost 329,000. And we had a record voter turnout at 77.6%. Without getting too much into the weeds, I wanted to share with you some specific actions taken by the county that were over and above the necessary steps traditionally taken to hold a general election. The county hired a temporary director of elections for the 2020 general election. When I first took office, the entire elections team, including staff and management, totaled 11 staffers. By election day, that number was over 100. The county, and in this case by county, I mean Councilwoman Christine Ruther, sought out and obtained a $2.2 million grant from the Center for Tech and Civic Life for elections related purchases, voter outreach, and education and staffing. The county purchased 50 ballot drop boxes and worked with all county municipalities to install these boxes, including live stream equipment in ADA compliant locations in and across the county. Again, this did not cost taxpayers a dollar, and these boxes can be used for many elections to come. We established 2 voter services centers in Upper Darby and Chester. We partnered with the Philadelphia Union for a 3-day open air mobile voter services center at Subaru Park Stadium. We established a new dedicated election hotline. We launched Delco Votes, which is a redesigned election website. We developed a significant number of PDF and video-based instruction materials for poll workers and held in-person and telephonic training sessions. In all, more than 2,000 individual local election board poll workers were trained on new mail-in ballot procedures, new voting equipment, and other election processes, primarily due to COVID, a significant logistical achievement. And we approach the process with an unprecedented amount of transparency and communicated news and updates to voters and the media as quickly as possible, usually across multiple electronic platforms, such as the web, Facebook, Twitter, and so on. To wrap up, the 2020 general election was a huge success. And in no small part, this was due to organizations like the League of Women Voters. So thank you again. Even so, the county is aware that we always have room for improvement. Training materials will be refined, and some issues experienced by some local election boards are being addressed. The county will continue to evaluate processes and protocols and work with state and third-party organizations to streamline our election process wherever possible. The county welcomes feedback and asks voters, parties, and organizations to contact us with their experiences, their constructive criticisms, and their ideas. County Council and the Board of Elections are committed to ensuring Delaware County voters continue to have full confidence in their vote and their government. So now to discuss the County Health Department. The health department and safety of our residents is Council's top priority. Unlike our neighboring counties of Montgomery, Chester, and Philadelphia, Delaware County does not have a county health department. We have seen concerning trends in public health through the years, and the COVID-19 pandemic served as yet another example of how critical a county health department is to a highly densely populated county like ours. So I'm just going to give you a little bit of background on what we've been doing for the last year on this topic. And so just days after the election last year, we began the legwork to establish a county health department. Myself and the new council-elects, Elaine Schaefer and Christine Ruther, and incumbent council members, Brian Zidek and Kevin Madden, created a dozen transition teams to gather information, identify key issues, and develop recommended action plans regarding a wide range of issues and subjects relating to the governance and management of Delaware County. One of the transition groups was dedicated to public health, and I know several of you served on various transition teams, so thank you for that. Beginning in December, as part of our transition process, Council worked with experts to identify the steps that were needed to be taken to create a public health department in Delaware County. On January 12th, I joined Councilwoman Elaine Schaefer, Councilwoman Christine Ruther, regional public health leaders and members of the community at Elwyn during a panel discussion on public health in Delaware County. The panel focused on the merits of a county health department and included presentations from neighboring public health departments. The topics included the roles of county health departments in protecting public health, utilizing data for federal funding, and detailing the ways Delaware County would benefit from a county health department and public funding. In March, we were faced with the COVID-19 pandemic. The importance of a county health department was clear well before the COVID-19 pandemic, and responding to COVID-19 provided valuable information about the public health needs of our residents. During the early stages of the COVID-19 outbreak in Delaware County, the county was dependent upon the state for information on the cases in the county, contact tracing for residents who tested positive, and guidance. A few weeks after the first case in the county, Delaware County entered into an intergovernmental cooperation agreement with Chester County, which identified responsibilities of the Chester County Health Department during the COVID-19 outbreak. Under the agreement, Chester County Health Department provides coordination of increased testing, case investigation and surveillance, quarantine designations, and health guidance to Delaware County. This has been vital in the prevention and testing of COVID-19 in residents, sorry. In August, council approved the request. In July, council started a steering committee that would be focused on implementing the health department. And that steering committee is headed by myself, and we also contracted with a private contractor who is helping us to establish our strategic plan. And then in August, council approved the request for proposals for an economic impact feasibility study. We have just gathered all of the proposals, and our goal is to choose an organization to perform the economic impact study by the end of this month. This January, we will begin the first phase of the strategic plan. In the first few months of 2021, our goal is to create a Delaware County Board of Health. And in the summer of 2021, we plan to hire a director for the new Delaware County Health Department. Hopefully, if we're still continuing to be on the same timeline. And in the summer and fall of 2021, we will begin hiring personnel for the newly created health department. By the end of 2021, we anticipate that the Delaware County Health Department will be operational. So our goal is to have it operational in January of 2022. We have made enormous progress since we officially began this process. And this is a testament to the hard work that those inside and outside of the government have assisted us with. In the coming months, we will continue to aggressively move forward with the timeline and plans to launch a Delaware County Health Department by the end of next year. We knew the need for a county health department was great, and now more than ever, we all realize the critical need. So I am going to bring up a PowerPoint just to kind of talk about the next steps in our strategic plan. Let's see. Really focus on a little bit what the steering committee has been doing. Let's see. All right, I believe it's up now.
Yes.
Okay. Okay, so looking at it. So our public health steering committee, these are the members of our steering committee. It's myself, and then we have a representative from every single health network in the county. And we also have a few representatives from, I guess, education, and also we have representatives from intercommunity health, and some of the township health officers are on this just because they're going to be a critical piece to putting together our health department, along with government and the foundation. And we have infectious disease experts on the steering committee also. So the charge of the Delaware County, the steering committee, is to recommend a set of programs and policies, rules and regulations, staffing patterns, and budget for the Delaware County Health Department. One, we're using two different pieces to kind of put together the health department that we see. The first one is the Public Health 3.0. And so this is kind of a new inventive way of looking at designing public health departments. And so a few of the goals of this are going to be: one, embrace the role of the chief health strategist, engage in cross-sector collaboration. And for Delaware County, that's a big piece because we have gone so long without a health department. We have several entities and nonprofits who do a great job at providing services to our community. And so trying to make sure that this health department kind of blends into what is already there, the infrastructure that's already there, and provides more coordination between that infrastructure and fills those gaps that we know are there is really a key to this. We will be trying to seek accreditation and gather. One of the big pieces that we know is missing here in Delaware County is gathering timely and relevant data so that we can act upon that data. And then, of course, exploring innovative funding opportunities. The other piece to this is looking at the foundational public health services and looking at our public health infrastructure and trying to build it off of this concept. So looking at assessment and surveillance, emergency preparedness and response, policy development and support, communications. Communication is really key. One of the gaps here is trying to communicate between all of those entities that are providing health resources within the county. Community partnership development. And so one of the great pieces that we haven't had a health department for so long is that we have a lot of community groups such as yourselves and others who have been in this space for a very long time. And so just those partnerships are already there, ready and willing to help with the health department. So that is a great part of this. Organizational administrative competencies and accountability, performance management. And so looking at some of the areas that we are going to focus on: communicable disease control, chronic disease and injury prevention, environmental public health, and maternal, child, and family health, and access to and linkage with clinical care. One of our big issues is equitable access to healthcare, and trying to make sure that although the health department will not provide the direct healthcare, helping once again with that communication piece and making sure everyone in the community has access. The vision of our new health department is that all members of the Delaware County community have access to the resources that provide the opportunity to lead a healthy and productive life. Our mission will be: the Delaware County Health Department strives to promote, protect, and assure conditions for optimal health for all residents of Delaware County through leadership, prevention, response, and partnership with the community. The values of our health department are going to be, we have broken it down into the areas that we thought were really important for our health department to focus on. And so we have equity, collaboration, leadership, accountability, innovation, and stewardship. So when we think about equity, the health department is going to strive to ensure conditions necessary for optimum health of all residents. Collaborations, we partner with businesses, organizations, community members, and government agencies to maximize the impact of all activities that improve health. Leadership, we serve as lead health strategists, advocates, and voice for public health in Delaware County. And accountability, we are committed to using the most current public health science and practices and being transparent in our operations. Innovation, we support a culture of professional growth and investigation to develop and evaluate leading practices in community health. And stewardship, we respect and honor the trust the public has placed in us to efficiently manage the county's health resources equitably, responsibly, and with integrity. So moving forward, we're kind of moving forward with our, I guess I would call it the first phase of our strategic plan. So the first phase is kind of more of an information gathering and also a PR campaign, along with a campaign with our state delegation for funding, to make sure that we have funding for next year when we open this health department. And so that's this phase one. And phase two is really more or less the implementation of those programs that are developed during phase one, and then the hiring and the choosing of the Board of Health. So when we're talking about phase one, we have 4 strategic goals. So the first goal is to secure support and funding for the health department. So our objective 1 is work with county and municipal health departments across Pennsylvania to increase Act 315 funds. So remember, when we're thinking about the health department, we could be approved, but the goal is, hopefully we'll be approved by the state, but the goal is to be approved, but also to have the state add funding to that line in the budget, because otherwise that pie of money will just be cut up by one more piece and it's already underfunded. And so we're working on that campaign along with other health departments. Objective 2 is to obtain approval from the Pennsylvania Health Department and the Governor's Office for Act 315 funds. And so we actually have a meeting next Friday with the Health Department to make sure, the State Health Department, to make sure that we are on the correct track for our proposal and that we have everything in place to ensure that we're going to get that approval from them, and develop a strategy to secure financial support from additional resources. So looking at other grants that are available and looking at having a permanent grant writer within the health department. Our strategic goal number 2 is to generate public support for our county health department. And so the objective 1 is, of course, develop compelling messages and materials, develop and launch a communications plan. And then objective 3 is establish a social media presence. So one of the ways we actually put together a PR group who will be working on just this aspect of it. And we will be launching a webpage on the county's website that's dedicated to the creation of the health department and informing the public about where we are in the process, how we got here, and kind of next steps and how the public can get involved with helping us with it. Strategic goal number 3 is to engage key stakeholders in the planning process. As I said before, we want to make sure everyone is involved and at the table in the beginning so that we can make sure that this health department fits what our county really needs. And so the first objective here is to identify individuals and organizations critical to achieving the mission. Develop a robust database of all of those organizations within the county. And the next objective is to provide meaningful opportunities for stakeholders to influence and inform the health department's establishment. So one of the things that we are going to be doing is a little bit different now, of course, because we're in COVID time. So we are trying to organize several different roundtable, so basically Zoom meetings with these stakeholder groups to make sure that we're getting as much input as possible as we're developing those programs and figuring out what is best for our county. Objective number 3 is to ensure a representative from each municipal health department is intricately engaged in the planning process. So as I said before, the municipalities, of course, are key in making sure that they all have a say in a big part. And so that's going to be, they're actually going to be one of our roundtables. We're going to have a roundtable with all the municipal managers or all that would like to come. And then of course, all of the current municipal health officers, just to get their input and, because they're the boots on the ground right now. And before we were even in COVID. So getting more input as to what they think that county health department really should be giving. And the next one is strategic goal number 4 is to establish the health department programs. And so objective number 1 is to develop program plans that meet Act 315 requirements and reflect the mission. And so we started a little bit here. We've established the Delaware County Wellness Center, which will probably be our main hub for our health department. And then we'll have smaller areas around the county. Hiring and contracting staff. Right now, we've been slowly hiring staff that will eventually fall into our health department once the health department's established, just because we've needed to hire them to help us in conjunction with Chester County's health department throughout the pandemic. So we've hired nurses that work directly for the county, and we're currently in the process of hiring emergency preparedness personnel. Right now, we have an emergency preparedness contractor, but we're looking to bring that in-house in the new year, since that position would have to be there anyway for once the health department is established. And so that they can work hand in hand with the contractor as we work through the vaccination process. Objective number 2 for this goal is to develop a financial plan to support operations. As I said before, we issued an RFP for this, and hopefully we'll have that back in February. I think maybe February or March will probably be the appropriate timing for that to come back, and establish a performance management system. And looking at the Pennsylvania Department of Health steps for creation of Delaware County Health Department, we will need to get a certificate of approval from the PA Secretary of Health. Then County Council will pass a resolution to authorize the department to send to the secretary. And then we will be able to start the process of appointing a board of health. That board of health will be a part of the process of appointing a health director, which we will be planning to do a national search for that health director. And then of course, then we're going to be preparing the departments. So that's the facilities, the staff, the policies, procedures, the rules and regulations, and we'll solicit approvals from municipalities. And then we will go for a request to determine readiness from the secretary. And then once we get that, we will provide notices to the municipalities of the start date. So once that's the last step of that readiness, so the way it kind of works is that we'll develop our proposal, we'll submit a proposal. Hopefully the goal is to submit our proposal to the Secretary of Health in the spring of this year. We'll submit that proposal. That gives us kind of temporary, as long as they say everything's okay, that gives us a temporary okay to start doing these next steps. Once we do these next steps and we get down to that determination of readiness, once we have that final approval from the Secretary of Health, then we are pretty much we have 30 days and they will be giving us funding and we will be operating as a full health department. So our goal is to go for that last readiness approval from the secretary by December of next year so that we're ready to launch in January of 2022. All right, and that is the end of the slideshow.
Do you want me to ask the questions, Monica?
Yes, sure.
Now, you've already addressed several of them that were sent in. For example, the timetable for implementation. You've talked about a little bit about our collaboration with Chester County. Are there other county health departments that you have looked to, for example, as well?
Yes, so when we had that first roundtable, we actually had the directors of the Montgomery County Health Department, the Chester County Health Department, and we have been talking to the Philadelphia Health Department too.
Okay. A lot of our questions, oh, and you did talk about the development of new staffing. Fully staffed, what do you anticipate the number of people will be?
We're not really, we're kind of working that out right now as we go through that strategic plan, the part of trying to figure out the programs and how many staffers we'll have. So one of the things we're going to do is the way the health department will really start, it won't be a massive health department to begin. We'll really start off with almost a skeleton health department, and that'll be providing all the services that are kind of the baseline services that are required by Act 315. And then we'll be developing over the next 2 years once we start into almost the larger health departments that you see. So rough guesstimate would probably be somewhere around 50 to 60 individuals to start. If you look at Chester County's health department, they have about 80, 85 individuals that are full-time staffers.
Thank you. We also had a couple of questions about what the Department of would focus on, and two of the areas in particular that were questioned. One was mental health, and the other was a lactation consultant. And in your diagram of the services, you had briefly mentioned them. Can you address those?
Yes, and so mental health will be a big aspect of our health department, but it will be in conjunction with our human services department. And so one of the things we've been talking about is looking at where the gaps are, and our human services working with them to figure out what is the best way for the health department to help to provide more mental health supports. And so that is something that is a priority and on the front burner for us. As far as the lactation consultant, we are trying to figure out what the program, so we probably won't know that until exactly that detail of personnel until probably later on in the process. But we are really focusing on maternal and child health because those are some of the areas that we're really failing on when we looked at our health study. And so that is also a big area. Some of the areas we were failing on were mental health as a county and maternal and child health. And so those are areas that we will be targeting with the health department.
We had several questions about currently the situation. For example, for tracking and tracing information about the pandemic. Do you have any information on the number of positive patients whose contacts have been alerted, and for example, for one infected individual on average, how many individuals have been exposed versus how many have been contacted is
Yes, so that number varies, but for contacts, the health department does contact every positive. And we were doing intense contact tracing up until probably about 2 or 3 weeks ago, once we really went into that community spread. Once you get into community spread, it's no longer called contact tracing, it's more of surveillance. And so there's targeted contact tracing, such as in the schools and in long-term care facilities, but in the community at large is more of a surveillance tracing. And we just went into an agreement with Temple University because we are using their public health students who have gone through the contact tracing program to actually help us with more surveillance and more contact tracing, because we're in such, right now, our 7-day positivity rate was about 12.7%. And normally anytime over 9%, we're basically in that area that can be considered community spread.
okay. We also have some questions about the role of, or how the vaccine, when it's available, will be distributed within the county.
So we are working on that right now. We've been working on it actually for about the last 4 or 5 months. And we have a vaccine group that's together that works with Chester County and also works with the state. A lot of it depends on the federal government, because they're going to be the ones that almost decide which vaccine we go with. And then there will be the mass production, and then they'll get it to the state. And then the state will kind of, at least the way it's been laid out thus far, I believe the state will be the ones that will let us know who is the first top priority. The states get to choose that. And we know it's going to be the frontline workers, but we're not positive of whether or not that's also going to include teachers, or there's variations that are out there. So we're not sure quite yet, but the county will have a big piece to play in that. And so that's part of our medical countermeasures group that has been working to kind of help to form that plan.
So they're in position right now, this medical
Countermeasures.
Countermeasures.
Yes, so we're in position to get it. We just need to get the final layout of what is going to happen from the federal government and from the state. But we are in position to help with that. And I know that there's also been talk of that we're going to use both the county resources, and the federal government is going to use private entities such as the CVS's and the Walgreens to help get the vaccine out once we get to that level of just the general public. And it looks like timing for the general public vaccine is more around April, May.
Okay, thank you. We also had some questions about development of a self-test at home for COVID. Do you have any insight in that?
Yes, I believe there are actually already a few self-tests that are available. We always recommend, and the health department always recommends, that individuals do the PCR tests. The PCR tests are the most accurate, and that is the high nasal. The ones that are the most uncomfortable are the ones that are the most accurate right now. And so that's kind of what we recommend, but there are at-home tests that are available.
And the PCR ones are the ones that take about 3 or 4 days to get the results.
Unless they take 3 or 4 days, unless like some of the hospital networks can do them fairly quickly in-house when they have patients that come in. And that's because they are running the tests in their own labs within the hospital.
Ah, okay. We also had a question, and this goes back to areas of concentration. We know your zip code is more important than your genetic code. Will the health department include environmentalists who will address environmental injustices in the Delaware Valley?
Yes, there actually, by Act 315, there is an environmental health department that is required. And so, yes, and so that department will be focused on environmental health in the county.
Okay, and now we have a few questions from our chat. The first question is, where is the wellness center at present? And do you know why there was never a Delaware County Department of Health until now?
So the Wellness Center at present, we haven't opened it yet. We are in the process of kind of retrofitting it, but it will be in Gaydon. And
Okay.
as far as, and hopefully the goal is to open that in the second week in January.
Wow.
And so we're kind of, the goal is to open that the second week in January. And then in terms of like testing, right now we're doing several, I guess, satellite sites. So we have the Upland site, that is a permanent site that will be doing COVID testing there pretty much for the foreseeable future. We've also partnered with Mercy Fitzgerald to do testing there, that the county is paying and providing test kits, and then they're using their staff to do the testing. And so that's for the next 6 months. And we're looking at also doing the similar contract with Mainline Health so that we can do testing at Riddle. And we also will be hopefully doing testing at the Delaware County Community College. So we'll be doing a full week of testing at Delaware County Community College the second week in December. And then our goal is to also have a permanent site of testing there at least a couple days a week. So we're trying to make sure we're hitting all pockets of the county so that it's really accessible for anyone who needs to go to get
And
tested.
for those testing sites, is a doctor's referral required?
No. So you have to have either symptoms or a known exposure and 12 years of age or older, and insurance is not required, but if you do have insurance, we will run the insurance.
And we had another question about where will the health department fall in the organizational structure of the county?
So the health department will actually be its own additional department. And so it won't really fall anywhere into, right now, it won't fall in like how we have intercommunity health. Intercommunity health will actually more or less be absorbed into our current health department, or into our new health department. And so who will it report to? The county health department will report to the executive director and county council, similar to our other departments. And it will operate similarly to how our human services department operates and our COSA, those departments that are closely linked to the state and have kind of state oversight also. That's how it will operate.
Thank you. What are the metrics for success in the short term and longer for this effort? And how will they be communicated?
I guess the metrics for success when we're thinking about the short term for the health department in general is trying to make sure we stay on this timeline. I feel like the short term is it's a really intense timeline for the next year that we're going to have to be able to stay on target to open this health department in 2022. And as we develop the health department, I think the long-term metrics of success will be looking at those health outcomes that have been reported by the Johns Hopkins study, and those areas that we're declining in, and those areas that we are so far behind our surrounding areas, trying to improve those metrics. And how will they be reported? Hopefully we'll be able to do some sort of health updates as we move forward. I mean, we've been currently doing health updates on in county council meetings. I've been doing them probably about every 3 months or so. Our goal would be to continue to do those health updates. And then we're going to launch that website for the public that will be updates on the progress of the development of the health department. And then hopefully once the health department is in place, we will be able to do more communications to the public on where we are, especially when we're looking at the health metrics.
We also had a question about what role can the League of Women Voters have in promoting the health department at this point?
I think working with the League of Women Voters, you are actually one of our stakeholder groups. So we were planning on having a session with the League of Women Voters anyway in the new year to kind of talk about where you thought we needed to go with the health department, what type of programs you thought we might need to add in, though, because you have been in the space for a very, very long time. And thank you for pushing this message. So I think partnering with you to get the message out there about the health department, but then also to figure out what is the best way to go about engaging the community too, because you are there on the front lines. And we will be having that session, so I will be contacting you to try and put that together in the new year.
Very good. Well, then I want to say thank you very much, Dr. Taylor, for the update and for reassuring us about what's going on right now with relation to COVID and the very ambitious and desirable planning that's going forward. You know, we're looking forward to being able to really celebrate in 2022 the actual birth of our health department. So I have some additional information to share with all of the participants. We have a very exciting lineup of programs for 2021 that I'll just briefly run through and tell you the topics we have in place. But before I do that, I want to mention that the League is currently conducting a post-general election survey, and we would certainly appreciate the input of anybody. If you haven't already participated, you can go to our website, which is lwvcdc.org, and click on the survey site and then complete it. Right now we have a little over 200 participants, and our goal is to achieve 300 participants. And then the programs that we have lined up for the spring months, starting January 14th, we're looking forward to a hot topic Zoom program with Kevin Madden of County Council, and the topic will be prisons, voting of the incarcerated, and reforms at George Hill Prison. Also in January, in conjunction with Penn State Extension, we'll be doing a Toss Your Hat in the Ring program. Anyone interested in serving your township, borough, or school district, and the roles, responsibilities, and personal rewards that come from public service will be discussed, and that date is to be determined, but please check our website because it will be updated, and we'll probably send out a constant comment, I think, as well. In February, we're looking forward to a hot topic discussion on redistricting, and we're contacting Carol Punahome of Fair Districts, Pennsylvania. Hopefully she'll be able to be our speaker. She's an incredible speaker and has been so assumed the leadership role of this in Pennsylvania. Then on February 16th, we're going to do our county council luncheon virtually, and the topic for that is understanding our local government agencies of Delaware County. And from the list that I read that Dr. Taylor is responsible for, and then multiply that times 5, because there are 5 council members, there's a lot to cover. On March 19th, we're looking forward to a hot topic virtual program on the National Popular Interstate Vote Compact. The speaker is yet to be determined. And also in April, our annual Jeanette Ross lecture, which is environmentally focused. This year, we're going to have it on what's happening with the Gibbstown, New Jersey liquefied natural gas export terminal development, and how will that impact Delaware County. Roberta Winters and Olivia Thorne will be working on getting the speaker for that. And our civic education group is planning a spring civic education program and the topic will be the financial issues of incarceration, cash bail, fees and fines, prison reentry, employment issues, and retaining legal counsel. And we will wrap up the year with our annual meeting in May, on Thursday, May 27th. So right now we're anticipating that all of these meetings will be virtual. If you're not a member of the League and you wish to join us, please go to our website, lwvcdc.org, and on the right-hand side, there's a little button that says join. We'd love to have you join us. For all these programs, you can register online, and when you go to our website, click on events, and they will all be listed there. So I think that about wraps it up, unless anybody else has something to offer, any of the board. Then I thank you all for joining us. I wish you.
Jane, this is Olivia. I just wanted to say yesterday, we did get a date finally for how to run for office. And it'll be January 7th at 7 o'clock to 8:30.
January 7th?
Yes, January 7th, which is a Thursday night from
Okay,
7 to 8:30.
thank you. And that will be on our website.
It will be on our website, it's on the Penn State website as well. So you'll find out a lot more about it in the weeks to come.
Excellent. Well, I wish you all a very happy holiday season, certainly a unique holiday season. And I thank Dr. Taylor again for a really informative presentation.
Yes, thank you.
Thank you for having me here today.
Bye-bye now.
Thanks, Monica. Thank you, ladies. Bye.